Michigan's Children proudly presents Speaking for Kids, the podcast where we explore crucial conversations impacting the lives of all Michigan children, youth, and families, especially the most vulnerable. Join us each month as we explore public policies and issues in the best interest of our kids and families. We'll bring you lawmakers and policymakers, advocates fighting for change, and the people most affected by those decisions. With our host, Matt Gillard, President and CEO of Michigan's Children, we'll invite you to become engaged too and show you how to take action on what matters most to you. Episodes are recorded live and shared virtually on YouTube and the audio hosting sites Apple Podcasts, Google Podcasts, and Spotify.
Hello, I'm Matt Gillard, the President and CEO of Michigan's Children, and welcome to another edition of Speaking for Kids, the podcast brought to you by Michigan's Children, where we highlight important issues that kids and families are facing or that could impact kids and families here in Michigan. We are recording this episode on October 23rd of 2025, and I'm very excited to be talking to a couple of very special guests today, and we're going to be talking about the Voices for Birth project, which is an important endeavor here in Michigan. And so I want to allow my guests to introduce themselves, and then we'll get right into the conversation. So I'm joined today by both Amy Zagman and Tashina Williams from the Michigan Council for Maternal and Child Health. You guys want to introduce yourselves quickly?
Yeah. Good morning. Thank you, Matt. Thank you to Michigan's Children for inviting us to be part of this podcast and share some exciting work that we've been doing as a second phase of work that we started a few years ago. But our Voices for Birth project is just something we're really proud of. So I'm the executive director here at the Council for Maternal and Child Health. Been doing advocacy and policy work for way too long, decades. But I am excited to be here with my colleague, Tashina.
Good morning, everyone. My name is Tashina Williams. I'm the policy director at the Michigan Council for Maternal and Child Health. This work has been a big part and a component of my role since I've been at the council for about almost 3 years now in January. So super excited to share some of our findings with everyone.
Well, thank you both certainly for joining us to discuss this important topic, but thank you more importantly for the work that you do every day on behalf of mothers and families here in Michigan. So I know Amy alluded to it a little bit, but Voices for Birth was designed to lift efforts, programs, and policy strategies that can improve maternal and infant health and address health inequities. So Amy, why don't you start and tell us a little bit more about the project and how it got started and kind of the genesis of this?
Yeah, thanks, Matt. Back in 2021, we did a first installment of this work. At the time, we really wanted to hone in on some of the inequities that exist in maternal and infant health. And so we published 7 briefs, called it the Birth Equity Education Project. We covered issues from financing to mental health to breastfeeding and really lifted up policy strategies that we thought could reduce inequities in those areas. And thankfully, and with a lot of support from legislators and from the governor and the executive branch, we've seen a lot of success with those policy strategies that we pushed forward. And we were very interested in expanding that work and understanding, digging a little bit deeper to find out what is the experience of individuals and how could we listen to their voices to lift up even more policy strategies, remove barriers to care, find ways that we could hopefully keep the trajectory going. Michigan now has our lowest infant mortality rate on record at 6.1, which is a representation of per 1,000 live births. So we're at our lowest rate in history in Michigan, and we want to see that continue. So we want to make sure that we're also seeing gains in maternal health because we know there's significant challenges there. So Tashina, would you like to add a little bit? As Tashina mentioned, her work really has been very focused on this area, and she's really helped us think about how we can best engage with communities to listen to what they're saying.
Absolutely. Like I said before, my role kind of really started kind of working through the birth equity education project and kind of following those things and making sure that we were keeping those a priority, as well as just kind of tracking it move through the legislature. And then throughout that work, in the beginning, I was kind of asked to see more about what the disparities entailed for a lot of our Black and Indigenous women, and really get the stories behind it. So from that, we did several interviews. I want to say close to 60 interviews across the state of Michigan, with the help of the Michigan Health and Hospital Association. And from there, we were starting to get like similar themes: not being heard, feeling like a number, those sort of things. And at me, before coming to the council, I was a research assistant, and I felt like I wanted to do something different. I wanted to do something active I feel like there's enough research out in the world, and I think at some point we just have to make the action. So from there, we identified the themes that women were saying, and then also we did kind of the convenings with groups across Michigan who has sat down with women as well and understanding their actual stories behind the numbers. And we were able to compile a list of themes that kind of informed what you see now for Voices for Birth. You see, we highlight topics such as quality of care, such as communication of care, decision-making, things of that nature. And I feel like I'm really excited to kind of unveil this to the world as something. This is what Michigan moms are saying that they want, and for us to kind of identify our policy recommendations based off of their stories and data as well, also as well as key informants and experts in the field, to come together for this very robust policy recommendations for each policy area. And as Amy stated, we had so many wins from the previous one. We're hoping to have another home run for Voices for Birth.
That's great. And one of the most exciting things from my perspective, right, and from an advocacy standpoint about this, is how you guys have really centered lived experiences of Michigan families in this work. So talk a little bit about why that's so important and why it's important to elevate those voices, and what especially we can learn from listening directly to birthing people.
I can go ahead and start.
Sure.
I think like when I first came into this world of advocacy for moms and babies, it really was like I kept hearing the same themes. Women aren't being heard. Women aren't being thought of as the experts of their own bodies. Like they don't live in it 24/7. So I think we really wanted to take the main complaint of not being heard, and really elevate that. And how do we really share their stories? How do we get them involved? I think we have done a great job of, in our capacity, although we are a small but mighty organization, we have even a small list of advocates from the stories that we interviewed with and other people that we come across with. And we have a membership with Mama's Voices, and with Mama's Voices, they're able to get training to become advocates. So again, like we want to make sure we're engaging folks, but also keeping in mind of our bandwidth, right? And I think also too, what's so important is just, I feel like legislators, they see so much data, but I think what really hits home for them is when they see a constituent, when they hear a story that's similar to theirs. I feel like all the time, Amy and I are being, not I wouldn't say bombarded, but I feel like people are always interested in sharing their birthing stories with us. And I feel like, it's nice for us to know, but the people who really are driving that change, is even more important for them to kind of hear that. I don't know. Amy, did you have anything to add to that?
Well, I think you hit the nail on the head, Tashina, which is, we know that legislators respond to real people. So part of it is creating the opportunity with a timely and appropriate policy ask, but then bringing the real voices to talk about why that's important, why that could be life-changing, how that could prevent a poor outcome for someone else, which is really the driving force for so many people who get involved in advocacy, is because they want it to be better or different for someone else. And so, so many of these women have been vulnerable with us. They've shared their stories for that very reason. They want it to be better. They want it to be different. So we've, like Tashina said, listened to the themes and their stories, and are going to be thinking about ways to change Medicaid policy, to change rules, to change legislation, to fight for appropriations, and then plug in their real stories to drive home that point with legislators.
Absolutely. I think that's also a good point. I think also too, just to piggyback, I think it's also important too to not only hear from Michigan families, but the coalitions that we're in, a ton of coalitions, as well as the women. But I think even then, it's even more helpful for us to develop policy and thinking even about implementation, because we may have implementation barriers that we may not know of. and that they're bringing some of those things to us that boots on the ground, people who are experiencing these things can only bring forward. And I think also too, a lot of time these women are eager to tell their stories, or they're waiting for someone to ask them their story. So I think it's not that there is a shortage of stories. I just think it's just, we just have to continue to elevate and encourage folks to get involved in advocacy efforts.
Absolutely. I mean, one of the big themes, obviously, around this issue, particularly, and it's not just in Michigan, but certainly has been at the forefront of the discussion in Michigan, is really around inequities. And so, how does this project, how does the Voices for Birth really highlight the inequities in maternal and child health across Michigan? And what do you hope that leaders who hear these stories take away from these examples?
We know that we can show inequities through data. So, the series is, the original installment, the new Voices for Birth. We really try to lift up data and show in very stark terms the inequities that exist, racial inequities, geographic inequities, and point those out. But we also, through the voices of folks who've actually lived and seen through their own experience, whether they're providers or whether they're patients, consumers, they can point to where they've seen other people be treated differently than they have. And so those are ways that we can give face and voice to the data. So, we can share the data. It shows what it shows. We've been looking at the same trend lines for years, where we can see very clearly that Black and Indigenous families have 2 to 3 times the rate of maternal death, maternal morbidity, infant mortality, infant morbidity. We can see those things. We can show those things, but we have to be able to bring them to life. And so, it's really been our driving focus from the very beginning to listen to what's causing those inequities, look at the data, and then look at evidence-based strategies that are purposely built to reduce those inequities and focus on those things. We know that if we do that, Tashina says this all the time, so I hate to steal her term, but when we make it better for the most vulnerable populations, we will make it better for everyone. We will improve maternal and infant outcomes for everyone if we focus on those furthest from opportunity.
And that's really
Absolutely. I think
advocacy
you,
gold, right? I mean, that to have the data and then have the personal stories to complement the data is really, from an advocacy perspective, that's advocacy gold. All right, Tashina, sorry.
no, you're fine. I think Amy did a good job of answering that question. But I think I would like to add, I think what we really are hoping that leaders take away from this is really just a view of what it truly is like for moms and families across Michigan. I think oftentimes we think about maternal and child health and the maternal health crisis. Um, it seems so big and so vast and a little hard to digest. But I think in our series, we break it up in a way where it's a little bit more easily digestible. And like I said, we have key experts and we have tons of stories. We have videos. We have this very like fruitful pieces that really get at the topics, the inequities that families are facing. But I think, to our point, I think we really just want to open up our world and share it with folks so they really understand the scope and the depth and what we were. And mind you, this is just one topic session that we cover, but it's so rich to really understand. And I think in Michigan, we're very unique in our challenges as far as resources being distributed geographically. We're challenged. So just highlighting those specific things, I think oftentimes Amy and I are always looking for national experts to have certain data on Michigan, but I'm like, no, we need to be able to have a Michigan resource that hits on a lot of those topics. In addition to that, we also have a resource section on the website as well, voicesforbirth.org, where we are also highlighting, again, Michigan data. I feel like oftentimes it's harder to find. There's so many different, you have to know someone to know someone. We want to cut through the chase and make sure people can see the issue, feel compelled to do something about it, and really just make things better for our families. I think it really does start before the baby even gets here. It starts there.
Absolutely. All right. So, what role can nonprofit leaders or child advocates, or really anybody who's listening or hearing this podcast, what role can we play in amplifying these voices beyond the project itself?
We have started becoming active on our social media, so our LinkedIn, our Facebook, as well as YouTube. So just engage with us there. We'll be continuously promoting the project, promoting different pieces of it. Voicesforbirth.org, please visit that. We will continuously be updating the website with different videos, different resources. As I said, like we have data sources, research papers, and there's also resources embedded in the actual brief. So I would say just engage with the material, share it, and use it as you see fit. But I feel like I said earlier, I don't know if there's a Michigan source that is so rich in data and hits on all the inequities as we do. But we'll be open to if there was something of that nature.
Excellent. And I know you hinted at this, but you're going to be releasing video stories throughout the year. Can you share an example of a story that maybe especially moved you or really captures the heart or the essence of what the project is about?
I'll go ahead and take this too, Amy. I'll be quiet in a second. But I think Tania's story, I think her story was very impactful to me. But essentially, her story is about her struggling with mental health and postpartum depression after. And I think oftentimes people think, birthing is supposed to be joyous, but oftentimes when families get back home, reality sets in. There's so many challenges for families to adjust to. And I think in the heart of her story really just shows like, it can happen. Postpartum depression can happen to anyone. Again, not a topic that is often talked about, to making sure that mom is okay and things of that nature. I think it really hit home to me, just showing like this can happen to anyone. Anyone can kind of be faced with these inequities that we highlight in Voices for Birth. So I think it makes it relatable and almost like hits home, because I feel like almost everyone knows someone who has struggled with postpartum depression.
My labor was super smooth. I did a lot of preparation for that. What I didn't anticipate was postpartum struggling so much. When I discharged from the hospital, nobody talked to me about mental health. Nobody shared any resources with me, and if they did, it was somewhere in a huge packet, and it wasn't a warm handoff that would have done me more justice. I was really fearful that someone would want to take my baby based on the thoughts that I was having, and everything became a what-if scenario. I remember I would be looking at my iPhone charger and just be like, oh, what if this catches on fire? Having racing thoughts, having those intrusive thoughts is something that we don't talk about. To other mothers who are out there who might feel scared, dismissed, and alone, you're not alone. Unfortunately, a lot of mothers go through this, and it's something that we're trying to shift.
And again, I think the videos, again, bringing the humanity compared to when we had the Birth Equity Education Project, where you can actually see someone, hear their story, like, oh, this person looks like me, or oh, I had a similar story, or I had a girlfriend who had a similar story. So I think just again showing that it's not a far-fetched idea of any of these disparities that have happened to you, regardless if you're Black or Indigenous or other.
Yeah,
Amy, did you want to add?
Yeah, I just want to encourage people to, watch not only Tania's clip, but we have all the clips on our YouTube channel. They're linked on our website, voicesforbirth.org. And, each story has, just such a rich, content as far as like people's individual experiences. And so I just encourage people, that hopefully this clip helps you see sort of the breadth and depth of the conversations that we had, and then encourages you to watch all the videos.
Also, I wanted to add, I think with this series too, and another story I like a lot was Tamika's story, who's a woman who's disabled, who has children, and her experience navigating that journey. I think we have also given voice or acknowledgement to some of those, and I guess not typical populations that we speak about. When we think about birth inequities, when we think about maternal and child health, I think oftentimes we do not talk about them enough. As far as families with disabilities, young families, perinatal loss and grief, what happens if mom doesn't come, or what happens if baby doesn't come home? That happens. But just again, giving breath and light to change that trajectory for those folks as well.
People talk, you're gonna have children, how are you gonna run after them? How are you going to, take them out the crib? Those type of comments kind of does a number to you. After I had my children, I've seen other women with disabilities had to be very inventive with assistive technology to help them care for their child. What I love being a mother is just seeing them growing up, seeing them come into their own, personalities and interests. And I think it's the best thing being a mother.
So, what policies or programs highlighted in this Voices for Growth project do you think really hold the most promise for capturing the attention, maybe, of this, divided legislature and tough political landscape that we have here in Michigan for really reducing health inequities in Michigan?
We have been pretty lucky. So, as we talked about uh, with the original series a couple of years ago, there's been, with the leadership of the governor, with the cooperation of the legislature, we tally about $100 million in new funding in the state budget directed really towards maternal and infant health. What we're really quick to tell legislators is you can't fund any one of those things for a short period of time and expect that we're going to see long-term results. So this is all about the long game. It's about sustaining many of those things that we've done. So Michigan has made a lot of changes for individuals who have Medicaid coverage, who we know are some of the most vulnerable. So, we've extended their coverage to 12 months postpartum. We've added doula coverage. We've added group-based prenatal care, which we know really has the not only added benefits of making sure that people get prenatal care, but doing it in a way where they have natural supports, where they're grouped together with people who have similar due dates. And, we've seen this success, but we have to maintain this success. So, in addition to those Medicaid changes, we've given money to hospitals to make sure that no matter where you birth in Michigan, you're going to be taken care of at the top standard of care. So if you have a hemorrhage, or you come in with hypertension, or if you have a sepsis infection, we want to make sure whether you're in Escanaba or Three Rivers, that you are getting the same standard of care, regardless of what you look like, regardless of the hospital. So, we're really excited to see some of those changes resulting in better outcomes. And like I said, a best on record infant mortality rate, but we have got work to do. And we cannot afford to take our foot off the gas. That's our real message, is we have to keep adding more things if we expect to see long-term results. And we definitely can't subtract anything, which we know in this environment is a real challenge. We just went through a budget cycle where we had to fight to keep most of those things on the plate. And we know that the fight will only intensify with federal funding being cut. So we're all in this fight together. I think the biggest message that we want to send with Voices for Birth is we've been digging in and listening. We hope other folks are listening. We know people are living these very experiences, and we want them to feel a sense of community and be compelled to act about these things. And so we hope that Voices for Birth provides the resources for anyone who wants to advocate on maternal and child health. We've mentioned it a couple of times, but everything is on the website, voicesforbirth.org. And we hope that if you're interested in sort of sticking with us long term, you can sign up for our newsletter. If you scroll to the bottom of the website, most Fridays, we send out a newsletter and try to talk about what are the timely opportunities to be engaged in advocacy, because we know everyone's busy, and that our voices are louder together.
Absolutely. No, and you're absolutely right. The fight continues. Tashina, anything else to add before we wrap this up?
I guess I think Amy definitely closed this out really well. The only thing I will really add is do not cherry pick from programs. I think oftentimes we're always asked, like, what is the one thing that you need? And I think a lot of our families are in multiple programs, and that's how we see these great outcomes. So I think just continuing the investment, and it takes multiple things. These are whole people with different experiences, and it's not just the pregnancy itself, but what are the outside factors, and addressing those as well. So I think what I'm saying is we need more than one program. We need to continue the investment in the variety, because we know that not one model fits one family. So continue to offer diversity in programming, and I'm hoping to get better outcomes. But there is not one silver bullet. This is like the starter pack of how do we start addressing those inequities. So yeah, please be sure to think of us as a resource and stay in touch through Friday Notes.
Excellent. Well, I want to certainly thank Amy Zagman and Tashina Williams, my two special guests today from the Michigan Council for Maternal and Child Health, for being on the podcast, agreeing to be on the podcast, but more importantly, for the work that they do every day on this project and to make Michigan a better place to have a baby and to raise a family. I also want to thank everybody for tuning in. And please, as Amy said and as Tashina said, please get engaged with this very important project at voicesforbirth.org. You can find everything there. I'm Matt Gillard, the president and CEO of Michigan's Children. Thanks for tuning in to our Speaking for Kids podcast, and tune in again next month where we'll be discussing another issue of importance for kids and families in Michigan.
You've been listening to Speaking for Kids, the podcast for Michigan's Children with host Matt Gillard. Thanks for joining us. To explore these and other issues relevant to our state's children, youth, and families, and to build your advocacy muscle, go to our website at www.michiganschildren.org. You'll find links and news about past and future podcast topics under our Resource tab and action alerts under the Take Action tab. Find and like us on Facebook and Twitter. And Stephen Wallace produced this podcast. Contact them with your questions and ideas for other topics. Michigan's Children is a nonprofit advocacy organization, an independent voice working to reduce disparities in child outcomes from cradle to career through policy change.